Great. Well, welcome to everyone to this evening's panel discussion. First, we're going to have a welcome from the Dean of the Faculty of Environment, Naomi Krogman.
Good evening, everyone. Welcome to the panel tonight on charting the strategic path out of COVID-19, a public panel discussion on COVID-19 in BC. I am speaking to you from Burnaby Mountain, home to the Coast Salish peoples, with whom we are grateful for sharing their lands with us and advising us on how to build a better relationship with the First Peoples of these lands. We are so fortunate to have an amazing lineup of speakers tonight that makes this panel truly transdisciplinary, linking up academic expertise with applied and practical knowledge on the pathways out of COVID-19. Our speakers tonight are leaders in the sciences, social sciences, the business world, in BC communities, and who are frontline clinicians and healthcare workers. The organizer of this panel and moderator for the discussion is Andy Longhurst, a PhD student in the Department of Geography and the Faculty of Environment at Simon Fraser University. As a geographer and health policy researcher, Andy is interested in the spatial, political, economic, and social dimensions of healthcare policy and governance in Canada and abroad. He has published research on a variety of topics, including long-term care, harm reduction, primary care, surgical wait times, and labor market restructuring. Andy, I'll turn it over to you.
Wonderful. Thank you so much for that introduction, Naomi, and for everyone for joining this evening. So the aim of tonight's discussion is to provide an opportunity for reflection of where we're at in the pandemic, but also to look forward to what it will take for us to chart a strategic path out of the COVID-19 challenges we currently face. In doing this, we brought together a distinguished group of speakers who will provide insight. I want to give you an agenda first for the evening. So I'll begin by providing very brief context for our discussion, and then we'll move into a conversation between our panelists. At 8 p.m., we'll move it into an open discussion for questions from you to our panelists, and close the evening at 8:30. At any point, if you want to ask a question using the chat function, you can do so, and please indicate if you have someone in particular that you would like to answer the question. I want to remind you to please ensure that your comments and questions are respectful. Any harmful, hateful, or disrespectful language towards any individual or group will not be tolerated. The discussion, just so you know, will be recorded and it will be made available after tonight's discussion on the SFU Faculty of Environment website at a later date. I want to turn now and provide a bit more context for tonight's event, and I'm going to just pull up the slides for the evening, or for that context setting. So in our discussions, a number of there are different strategic policy approaches to pandemic management. That includes COVID-0, or what is often referred to as an elimination approach, and that refers to aggressive suppression with the goal of eliminating community transmission and keeping cases as close to zero as possible. We can see this employed in Atlantic Canada, Australia, New Zealand, South Korea, Taiwan, among other countries and jurisdictions. It involves strict short-term measures for long-term benefit, with sustained proactive focus on a system of testing, tracing, isolating, and providing social supports. And the intent here is to avoid cycles of lockdown and release. And obviously, location and borders matter, geography matters. But in this way, it's not the only consideration that we need to take into account. And elimination is not to be confused with complete eradication of COVID-19 globally. This is in contrast to a mitigation approach, allowing a certain level of community transmission without overwhelming hospitals or healthcare services. In practice, what we've seen is this balance has proven to be very difficult to achieve. And as we know, here in BC and Ontario and much of the Canadian provinces, we're grappling with that, the challenges right now. So in provinces west, we've seen mitigation used in provinces west of the Maritimes, the US, and most of Europe. And then somewhat straddling both of these orientations is a near zero or a no more waves, or what might be called a Canadian Shield approach, which was developed in December as part of an effort and a group of multidisciplinary scholars and economists and folks from the business community, and they released a report last December calling for a Canadian Shield, which is broadly similar to an elimination approach, and importantly requires clear strategic objectives. But one of the questions is, with this approach, do you get the full benefits from elimination? So I think these are all important strategic policy approaches to keep in mind in tonight's discussion, and we'll talk much more about that. An interesting new commentary published in The Lancet only yesterday came out, and this group of scholars showed the differences between those OECD countries that had pursued elimination versus those that had opted for mitigation. And so here we see that the elimination or COVID-0 jurisdictions had many fewer deaths per million per day, as we see on the left. And then in terms of economic growth, elimination countries performed better. And then lastly, in terms of civil liberties, elimination countries, because of their efforts to really eliminate community transmission, were able to have many fewer restrictions. So just in conclusion, I think these are important distinctions, and they reflect distinct policy choices that these jurisdictions have made. So again, just to refresh you, different approaches: elimination, mitigation, or what might be a hybrid, no more waves, or a near zero approach. And then lastly, this group of researchers in their commentary in the Lancet concluded, based on the evidence, saying that countries that opt for rapid action to eliminate SARS-CoV-2 with the strong support of their inhabitants also do better to protect their economies and minimize restrictions on civil liberties compared to those that strive for mitigation. So looking ahead, mass COVID-19 vaccination is key to returning to usual life, but relying solely on COVID-19 vaccines to control the pandemic is risky due to their uneven rollout and uptake, time-limited immunity, and the emergence of new SARS-CoV-2 variants. And then lastly, keeping this in really global perspective, and that's certainly necessary with our discussion tonight, is that national action alone is insufficient, and a clear global plan to exit the pandemic is necessary. So I will conclude there and move to introduce our group of speakers for this evening. And wonderful. Okay. So I'm delighted to introduce our distinguished speakers for the evening. David Alston is a repeat tech and marketing startup entrepreneur, founder and coach at MarketSwell Solutions CMO Accelerator Program, and a former entrepreneur in residence for the New Brunswick government, co-founder of Brilliant Labs, a Forbes top 50 CMO in social media, Radian6's former CMO and Salesforce's former marketing cloud chief adoption officer, and advisor to many startups in the Atlantic region. Dr. Lisa Barrett is an infectious disease physician and assistant professor in the Department of Microbiology and Immunology and Department of Medicine at Dalhousie University. Dr. Barrett has been championing efforts to increase access to community-based rapid antigen testing in Halifax, which has become a key part of Nova Scotia's COVID-19 testing strategy. Dr. Carolyn Collane is a professor in SFU's Mathematics Department and Canada 150 Research Chair in Mathematics for Infection, Evolution, and Public Health. Dr. Collane is a member of the BC COVID-19 Modeling Group, which provides independent scientific advice to government. Also delighted to have Nick Diamond, who is a third-generation restaurateur who owns and operates the Main Street Diner in Nelson. Nick's recent advocacy gained provincial attention and spurred discussion on the issues of workplace safety, interprovincial travel, and the challenges facing small businesses. Dr. Kelly Lee is Professor and Canada Research Chair in Global Health Governance in the SFU Faculty of Health Sciences. Dr. Lee currently leads the Pandemics and Borders Project, an international research team analyzing the use of travel-related measures during the COVID-19 pandemic. And last but not least is Dr. Amy Tan, who is a clinical associate professor in the Division of Palliative Care at the UBC Faculty of Medicine and a palliative care and family physician in Victoria, BC. She is also an anti-racism consultant and educator, as well as an advocate for health equity. And I'm so delighted to have all of them with us today. And thank you for being with us. Carolyn, I want to first start with you. In BC, we seem to be bending the curve down. Your team has been modeling what the next few months may look like. And if all goes according to plan with the vaccination campaign, where does that leave us this summer and fall? And why are these next few weeks and months so critical?
Thank you. Thank you for the nice, kind introduction. And I'm really looking forward to tonight because I think the conversation with business, with the Atlantic provinces, with medicine and across governance and policy is so important to have. And it's one that we don't hear very often. So I'm excited about it. And thank you for organizing. The next few months are critical in the sense that we finally have a new tool in the toolkit. And we've been saying for months that it would be great if we could use all the tools in the toolkit, and meaning to some extent rapid testing, which we haven't used as much in the West, as you mentioned, and in Central Canada as it's been used in the East. But now, of course, we have our shiny new tool, vaccination. And we're rolling it out as quickly as possible to as many people as possible through the deferred second dose, starting with getting a first dose out to everyone as fast as we can. And the aim of that is to reduce transmission, which so far the main tool in the mitigation world has been widespread social distancing measures, closures of indoor dining, restrictions on how many people or who you can have in your house or socialize with and where you can do that. So now we have vaccination and we finally have this new way to dent transmission, and hopefully it's fantastic. I mean, it is fantastic that we have it. And by hopefully, I mean, what we all want to do is vaccinate to the point where we can reopen our economies and our social lives and go back to normal as if there's no pandemic. That's the hopeful end game. What we're looking at, with models, and models, I should say first, are an important tool for this because models can explore scenarios at the whole population level, which you can't easily do with direct experiments or waiting to try it out in lots of different populations. So we use models to try to think about how much immunity will we get by vaccination in the current rollout with the current estimates of efficacy. And when we do that, we find that it seems like it's unlikely that when we vaccinate everyone, we'll be ready to just roll back to normal completely without seeing rises in infections. And that's because right now the surveys suggest that enough people will decline the vaccine. And of course, there are children and youth who aren't eligible right now. So we won't all be protected. And because of that, we may still, when we reopen completely, if we did, we would still see enough hospitalizations in the mitigation provinces to put that pressure back on the healthcare system. So that's the bad news. I think the good news is that vaccination works. It's working in populations around the world. It will work here, and we will be in a position to reopen substantially in the summer, but not, from what our estimates are, to go completely back to normal. So we will still have COVID around, we'll still have to watch for it, and we may still be at risk of putting those pressures on the healthcare system in the mitigation provinces.
Thanks for that, Carolyn. I don't know if others want to jump in there or if I'll go to Dr. Amy Tan. As a physician, you know very well the pressures that we're facing, not only here in BC, but certainly across the country. You've even told me that physician colleagues in other provinces are being told to prepare to work in the ICU, which is no small task and requires specialist training. So from your perspective, how did we get here, and what do we need to be doing over the next few weeks and months here in BC?
Thank you again for the introduction and for inviting me to participate in this panel. I'm really looking forward to the conversation. So yes, I am a physician, and I actually have worked through the pandemic in both Alberta and BC. I actually moved to BC during a pandemic. That's for a different story and a different day. So I lived the first wave and part of the second wave in Alberta, and then part of the second wave, and now the third wave in BC. I think it is really unfortunate that west of Quebec, we have continued to allow the waves to happen. And I think the third wave of all waves has been the one that we had the most warning signs because of what was happening in Europe, specifically in the UK at Christmas time with word of the B117 variant and what it was doing. And I think there may have been, I mean, absolutely there was COVID fatigue, and there was a real sense, especially around the holidays, of wanting to get back to normal. But unfortunately, this virus really has a mind of its own and was still here. And unfortunately did increase in cases after the new year. And with the increase in transmissibility with some of these variants, B117, P1, now B1617 and others, we know that less contact is actually still allowing spread to happen. And it is alarming. I talked to my colleagues in Ontario who are right in the thick of the third wave. I have family physician colleagues who are being trained with one buddy shift to be an ICU nurse and are now working in the ICU. Other physicians of other disciplines have also jumped in. And I think this underscores that when we talk about ICU capacity, it really isn't just a bed or a ventilator. It's really about the trained, skilled, specifically skilled staff that are needed to provide ICU care. Every discipline in medicine, we're skilled in different things. It's a system, it's a healthcare system for a reason, because we do all have our part to play in the puzzle. And so we can't just jump into another person's role. And that is the concern with regards to how much we are providing care for people with COVID-19. But on top of that, and I think something that sometimes gets missed is with the overwhelming of hospital capacity, it's anybody who needs hospital care, be it a patient who has a heart attack or has a car accident or a stroke or has cancer and needs surgery in a very timely manner. All of these things are affected. So it's not just COVID-19, it affects every person in Canada when the healthcare system is overstretched. And the last thing is really that all us healthcare workers, we're human beings as well. And this is the third wave, and it's been a long slog. It's probably the best way I can describe it. And I think we are lucky that we do have very dedicated healthcare workers across the country, you know, respiratory therapists, personal support aides, healthcare aides, nurses, physicians, OT, porters, housekeeping staff. We're all dedicated to this, but with outbreaks and people getting sick or being isolated, there's no backups. And this is, I think, what we're seeing in Ontario. And I am very concerned that BC is not far behind, and perhaps other provinces as well. And so what are we going to be doing nationally with regards to our Canadian healthcare system? Is something that literally keeps me up at night.
Well, in addition to the immense pressures on the healthcare workforce, small businesses have been faced with incredible challenges over the last year, and especially right now with current restrictions. Nick, I want to bring you in. Can you tell us a little bit about what happened to you and at your restaurant in Nelson earlier this month, and what the challenges, really the challenges you're navigating right now?
Yeah, well, thanks again for having me on. It's an honor to be in this group. I think I don't have enough years of education to sit here, but I got years of experience. Yeah, my family's owned a restaurant in Nelson for close to 40 years. And when COVID kind of blew up last spring, my aunt, who was running the show, asked for some assistance. And so I've kind of taken the reins, and with a lot of her help, have been very involved down there in the last year and have since bought the business. We're in the southern interior, so we're kind of on the fringe between two provinces. We do a lot of our economics and the kind of the feast or famine. The strong months are always facilitated by a lot of tourism, whether it's from the Lower Mainland or from Albertans and other areas of BC. But with the restrictions, they've changed so quickly, and quite often we're not really prepared for them. And a couple of weeks ago, it was actually the Easter long weekend. We were just seeing kind of a shift in energy. It was closing weekend at the ski hill. It was right after Whistler had closed down, so we were seeing and noticing some visitors speaking. They were had traveled here from other provinces to go to that area, and they found themselves in the interior. And it was just a tremendously busy day. It was a busy weekend, and it's been a busy few months and a lot of changes. So I think we were all a little tired, and things just kind of got a little unruly. I know my front of house staff, it's a really small team. It's a small restaurant. And specifically my front of house manager, he really hates being a bad policeman or having to enforce the rules. And he really found himself having to kind of deal with people that were just disrespecting what the province had asked of them, and not really showing common courtesy. People weren't wearing their masks on the street. They were walking off the street to try to use the washrooms, even if they weren't customers. And it was just a busy day overall. And as that kind of rolled on and the day got a little more stressful and a little more weight was put on us, I think I had a conversation with my back of house and my front of house, and we kind of reached the decision that we were in a fortunate position where business has been pretty good for the last few months, and we just decided we didn't want to put ourselves at risk. We didn't want to have to fight with the public. We didn't want to have to deal with people dismissing the rules or what's been asked of them by the province, and so we decided to close. And then that was a Saturday night, and we closed for the duration of the weekend. We closed Sunday and Monday. We're always closed Sundays. And I think it just alleviated a lot of the stress that was organically building in the moment. It was like genuinely just a overwhelming experience that day. And I think that when we made the decision to close, it kind of alleviated a lot of the stress we were seeing. And I thought it would be a better time spent to go do something else. And then I waited a day, and I decided to kind of, with hopes that maybe it wouldn't get as much traction as it did, I made a lengthy comment of the situation on my personal Facebook page, and it resonated with a lot of people, I guess, because it originally, I think, got picked up on the Island News. And I know that the Islanders, the Vancouver Island people, have had a lot of the similar concerns as we have, kind of being on a tourism heavy zone, and it did the proverbial viral. And I'm not used to that much attention. I like to go to work and run the restaurant, but I had a lot of phone calls from a lot of different people, and it gave me a bit of insight to the fact that the anti-mask camp, the people that are really worn out like the rest of us, but the vocal ones, it seems like they have an opportunity to get together. They're not as afraid of this as some of us. They're not as concerned about gathering in groups or bending or breaking the rules. And I think that a lot of people have been staying home, and a lot of people that are really concerned have been sitting in their houses. And so when I took a stand to kind of put health and safety of not only my business and my staff, but my community, that's really the community that's given me everything. It resonated with a lot of people, and people sent me cards. People sent me tips for the front staff. They wanted to donate money to good causes. It was overwhelming. The whole thing was a little much. And I think it just is a sign of the times. I think there's a lot of good people in the province that are very, very concerned about COVID, and they haven't had a voice. So I think I gave them an opportunity to feel like somebody was taking a stand for them. And that was not my intention at the time, but by Monday afternoon, it sure felt like that.
Thank you, Nick. Yeah, I can only imagine some of the challenges that you and your staff are facing. And I want to turn now to Dr. Lisa Barrett, who is in the middle of, I think, a very busy time with a large and kind of all of society testing effort in Nova Scotia to address the recent surge in cases there. Lisa, can you give us a sense of how Nova Scotia has been successful so far in maintaining very low levels of community transmission, and what you're grappling with now? And within all of this, what you think provinces like BC can take away from your experience in Nova Scotia.
Thanks, everyone. And wow, what a great group you've pulled together here to talk about something really interesting, and kind of nice to go from coast to coast, because to me, that would have been the way we would have started, middled, and ended a pandemic, with guidance that could be stylized to each province, but with an equivalent goal across all of our provinces. So let's look forward, not back. But I will say that success is a funny word. I think we've managed to keep cases low in multiple different Atlantic provinces, and we've done that differently. And I'm sure that David will weigh in on the New Brunswick situation. In Nova Scotia, we have had a very consistent and important, almost diametric set of both government leadership and control, and at the same time, community investment and leadership, which together has turned into a very powerful thing. So it's difficult to get anyone to say that our goal is COVID zero or elimination. I've worked for a very long time on another virus. So I'm an infectious disease doctor, and I've worked for a very long time on another virus where the E word, elimination, has been something I've been passionate about for a very long time, and that's hepatitis C. And so I came into this with not necessarily the lens of thinking we had to eliminate, or that we may not necessarily get there, but why wouldn't you try, keeping still in mind public health lenses of individual health as well as population health. So keeping in mind that we didn't want to do harm as much as we could while we were doing this. And so at the beginning, Nova Scotia had a very clear governmental directive whereby they took quick and definitive action around lockdowns very early on through wave 1, wave 2 in late November through to about January. We had a little blip in February, and things went back to lockdown, not close to lockdown again. And then with our wave 3, which has just started, which is why I kind of look like this and just kind of got home. So just for those of you who don't know what we've been doing, we did in wave 1 shut things down very, very quickly. And that included restaurants, bars, retail for a period of time. And then sequentially into May, June, and then by mid-June, late June, we had opened up quite a bit of our social activity. There were cultural events that were being held at small but present sizes. We could go out and eat. People were going to local restaurants. But just to be clear, we were still not inviting people into our bubble. We did have the Atlantic bubble, and that was a travel, and I'm sure you'll hear more about the travel related parts of pandemic management later from Dr. Lee. But we have always had a 14-day quarantine. You're not from the Atlantic bubble, thou shalt quarantine for 14 days. And that was the directive that was given. And we shut things down quickly, but then in the middle, we got to open things up. Many of my friends, I didn't happen to be one of them. I am a sad, lonely human who wasn't going out too much, but many people did have a number of times a week that they would meet with the people in their 10-person bubble or their 15-person social bubble, knowing that the virus levels were quite low. And the way we did that knowing part, which is difficult, I'm sure you can model the fact that an asymptomatic virus that spreads asymptomatically, and then you add on a variant and you make it more transmittable when you've got variants floating around. If you don't test when the cases are low, you don't know what's coming into your province or your area. And so we also not only had things open, but we tried to keep our testing rates high and, try and not super high, but, 1% of the population without symptoms every week or two. And it was around 1% every 2 weeks, just below for points of time. And so that was asymptomatic testing. That was well supported by the government. That wasn't just rapid testing. That was also PCR-based testing at usual sites. We headed into wave 2, and that was the point where the government said, ooh, we opened things up. We opened up some social settings where people are inside, unmasked. That sounds like something we shouldn't necessarily be doing unless we can do it with the supported testing. So we shut everything down. We didn't just do testing, we shut everything down, and then started very aggressive hospitality-based testing. And by that, I don't mean just the servers. We invited people who were going to be going out in a social setting after the lockdown was over in February to come out, get tested beforehand. Neg for the night, or negative for the night, was a very big slogan. And these, we did not use healthcare resources to run this testing program. It was run by volunteers, so that we did not use health resources, and we used rapid tests so that we did not actually have to use our lab. And so not a perfect test. Lots of people worried about what we call in other fields, risk compensation behavior. Everyone was going to run out willy-nilly and, I don't know, slobber all over each other or something, more so than they would have before, which, to be clear, people were slobbering anyway, so I don't think the test made a difference. As we've noticed in other fields and in infectious disease, like sexually transmitted diseases, HIV, Hep C, people have always worried about this with home tests, and that's not been something that for the most part's come to being. So we carried on forward, opened everything up, and a week after we had just gotten back to 100% of people at the mall, because that's what everybody wants, is to be at the mall apparently. There it was. We started to see our little niggly 6-7 cases of exceptioned workers coming back into the province. So we could always find that there was no community spread, 6-7 people identified in the testing. We suddenly went to a double-digit day, 13, which gave me chest pain. Then 2 days later, we went to 25. And then I was really wanting to change the way things were going. And our government just started shutting things down, just like that. Within 3-4 days, back we were going. We have had days in the last week, which is again our wave, where we have gone up to 30, 50, 60, 90, back down to 2 days of 70 now. And everything is shut down. We're in a circuit breaker for 2 weeks at least, and now all of our schools are shut down as well, because all our schools did have a lot of the cases that were present in the community, and they accounted for a large number of the community and non-epidemiologically linked cases over time. The other thing we are doing, in addition to locking everything down, and this is the last couple of words I'll say, and then we can get around to hearing lots of questions. I'd love to hear more of what other people have to say, and to hear some questions from the group. We have had now businesses that have voluntarily shut down, and Nick, very similar to something you were talking about. St. Paddy's Day, we had our Irish bars shut down voluntarily. Like, that's a big deal in Atlantic Canada, I gotta tell you. They just decided it wasn't the right thing to do on St. Patrick's Day, even before the cases were high. They just said, look, we know what's going to happen here. In the last couple of days, we have had over 1,000 volunteers that are now on our roster of people who come and run our voluntary testing sites for rapid testing. And we have been testing in total in the province, between rapid and non-rapid tests, almost 20,000 people daily. And our hotspot has a denominator, like the biggest area is the Halifax Regional Municipality with just under 500,000 people. And we've been testing about almost 20,000 people a day for multiple days now, 4, 5, 6 days. So we're getting a good sampling of what's going on in those communities, finding lots of positives in incredibly asymptomatic people. And those people are able to do contact tracing, and for it to be able to be supported by public health to stay home. And businesses are also offering people paid time to get tested and to volunteer at the at our testing sites. So hugely government-led, a little bit of control, but also community ownership, leadership, and guidance that together I think have been a hugely powerful component of keeping our numbers low. And I'm hoping that as we go through this, that this is going to be our peak, and we're going to go down by next week again fairly quickly. So I'll stop there, and I can take questions about this later.
Thanks so much, Lisa. That's a really helpful overview, and yeah, really, I think inspiring in terms of the community effort and just the community's role in testing and really having ownership over it. I want to turn now to Dr. Kelly Lee. We've heard now from Carolyn and Amy about the challenges we're facing in BC and how critical the next few weeks and months will be. So your research has focused on the importance of border and travel management and the role it plays in preventing the importation of new cases and variants. Even with our vaccination campaign ramping up, what do we need to be doing here in BC and as a country going forward?
Thanks, Andrew. And hi to everybody who's listening in through Zoom. Great start to this session. Our team has been studying this issue since the beginning of the pandemic and looking closely at what other countries do to manage their borders. We've also looked at other provinces. And a key thing is very, very clear. First of all, that despite initial claims by WHO and ongoing claims by parts of our government, travel is a major source and a source of risk for virus introduction and onward transmission. And there's a ton of evidence now that shows that. So we know that. And the other thing we know and that we've learned through our studies and through other people's studies is that border management, along with physical distancing, is actually two of the most effective public health interventions that have been used in countries that have done very well during this pandemic. So there are two things that are very important. So border management, travel type restrictions, and physical distancing. So what do we know then? What does this mean for BC, I guess, and for Canada? Well, despite repeated claims that Canada has, quote, among the most strictest measures in the world, unfortunately, that's not true. And we've looked at many, many countries and how they've handled it. And I think most people know that's not true in Canada. So since late February, we've started to move towards a kind of closer alignment to what other countries are doing that have kind of a gold standard, but we still have a ways to go. And so what would a gold standard look like? Well, we first of all have to shift the conversation, because we often hear, particularly policymakers dismiss travel measures as if, we're trying to slam a door. We can't close the border down, we can't ban travel. And they make it sound like, we're just kind of putting a big, huge wet blanket on everybody's movements. And that's actually not what travel measures are. So we have to shift the language from border closures and travel bans to border management. So the borders are never closed and travel never stops, but the trick is to figure out how do you manage that travel and border crossings in ways that minimize that risk of virus importation and it gets into the wider community. And we just heard that from Lisa, how they've done that very well with the 14-day quarantine. So it's not about slamming a door. The second thing is, at this particular point in the pandemic, when variants are emerging and we'll travel to Canada unless we act, when we've seen this repeated already many times, we need to plug those gaps that we have, close the loopholes, implement a system that has fewer exemptions. So pre-vaccination, there's evidence that shows that countries that have that border management where all travelers, regardless of their point of entry, land, air, or sea, regardless of why they're traveling, essential or non-essential, and regardless of the point of departure, where they're coming from. We talk about hotspots. I think the whole world is a hotspot now. Those countries that really apply those measures to all travelers are the ones that are effective. So we can see already that we don't do that nationally. So for the ones that are left over, there's a very few exemptions, flight attendants, flight crews, ship crews, transport workers, they need to be vaccinated now that we have vaccines. And, for some reason, we've been very slow at doing that. So that's another way we can improve things. And the fact, and what we heard already is quarantine. Quarantine is so important. So we have this 3-day quarantine federally only for air travel, and there are many exemptions to that, and land border crossings don't have that. We may have to have a debate about whether we allow people to wear maybe wristbands, bracelets, ankle bracelets in exchange for not staying in the hotel quarantine. But that's a discussion we've never had. We've just It's just never been discussed. It's never been introduced. So all of these things, of course, happen at the international border. That's where the formal points of entry are. It's where it's administratively easier, or although not easy. And it's where measures would have the most impact on the country as a whole. So keeping variants out of the country falls squarely on the shoulders of the federal government as our kind of, you think of it as a first line of defense. And if it's implemented effectively, we'll have very limited numbers of infections coming into Canada that are not detected, and we'll certainly catch most of them. And if you put everyone in quarantine, of course, it won't reach the community. But we also need to have border management at the provincial level, because it's kind of like our second line of defense. There's going to be cases that squeak through. We can't catch every one of them, even if we have a gold standard approach. And we know, that people are testing positive subsequent to coming into the country. I think there was reported in the CBC yesterday, 2,000 positive cases in international arrivals since February 22nd. And I think about a quarter of those were variants of concern. So clearly there are cases coming through. We actually don't have data to know where they were tested positive, whether they actually reached the community, but we know that we need provincial measures as well. Otherwise, once they're in, they start to spread around. And this is what we've seen. So just to speed up a bit. So we heard measures last week, as we know, here in BC, and they were focused on intra-provincial travel, so travel within the province mainly. And so, great, the government's finally admitting that travel is an issue. For a long time, it was even saying it wasn't, a concern. If we saw cases or we saw some evidence, we would move. Well, the cases piled up, and, travel clearly is implicated. So what I would say is that, most people are still a little bit confused about what I guess, stringency of those measures. We have the province divided up in these huge regions, mega regions. I'm not really sure what's different from what we already had, other than there's going to be some signs put up on the road between Alberta and BC. And we are asking small businesses again to kind of police this. The tourism industry is supposed to refuse bookings from outside those regions. A few other things, which, good move forward, but really we're still not looking at interprovincial. So between provinces, there hasn't been anything on that. So still lots of holes, lots of loopholes, gaps, and so on. So for me, what keeps me up at night, and lots of sleepless nights, is thinking about how both the federal and the provincial governments have dropped the ball on border management.
Thank you, Kelly. Lots to think about, and I think a number of issues that I know as a group we're going to want to come back and revisit. I want to go back and take us back to the Maritimes, to New Brunswick, where we have David, and he, I think, has some really interesting insights to tell us about both how the business community in New Brunswick has responded to what has been achieved and the approach that's been pursued in New Brunswick specifically, but more broadly in Atlantic Canada, but also I think resonating with a lot of what, David should tell me and tell us. I don't want to answer the question, but just in terms of some of the resonance with what Dr. Barrett was saying around the community ownership and the buy-in that we've seen, and perhaps how that differs from the rest of the country. So over to you, David.
Thanks, Andy, and thanks everyone. It's been a great conversation, and I'll try to build on actually what Dr. Barrett was first talking about. The Atlantic provinces do share a lot in common. Our approaches have been slightly different. And you point out a few things. I'm going to be speaking, I guess, as a business owner, as a citizen. So, and kind of the experience that, from sitting in that seat, what it's been like, and kind of the results that we've had, and the leadership that we've seen, both in the community and with government. So maybe I'll explain a couple of kind of maybe things that may or may not be evident if you're not in the Maritimes or Atlantic Canada. One of the things is that, of course, our population is of the provinces is smaller. Now, we're a little bit smaller than two Western provinces, being, Saskatchewan and Manitoba. Most of us, I know Nova Scotia would be very similar to one of them. And I would say Kevin Bacon doesn't have anything on us. We are probably more like 1 degree of separation, maybe 2. When you search Facebook of any name, you're going to find common people that know that person usually. And I think that aspect of a very connected society creates that element of when something's going wrong, you should be thinking about the other person in your community before you think about yourself. And that's a pretty common thing amongst the Atlantic provinces. Now, it's a common Canadian thing too, don't get me wrong, but it's probably we're probably more hypersensitive to that as well. Partly is because if you're in your community and you're doing stuff in a very, I guess, me first, selfish way, you stand out like a sore thumb. And it's, you pretty much, your community is going to kind of take quite a bit of an offense to that kind of approach. So the kind of think about your neighbors first is kind of a key thing. So I think that general Atlantic Canadian kind of view of connectedness has meant that we've been maybe a more compliant society when it comes to the province asking us to do certain things. And it creates a quick kind of tipping point when new measures come in. So for example, similar to Nova Scotia, when we were lucky that our March break is the first March break in Atlantic Canada, I believe, versus it was like a week before Nova Scotia. So once we literally came back from March break, we locked the province down. And it was with just a handful of cases. And we stayed in lockdown for a long time. And it was actually months later when we had literally gone, and I'm going to get this, I'll just roughly estimate, but it was probably close to 3 weeks that the province had gone with no active cases and 0 cases every day. So we had basically we did reach COVID 0 for 3 weeks straight, and we still weren't open. We were still in lockdown. And part of it, I think, is that this was all new to everyone. And it was like, well, how do we reopen? And how do we do it safely? And no one had a plan. Literally no jurisdiction had announced a plan at that point that you could borrow from. None of the provinces have done that. So I know a colleague of mine and myself got together and we said, well, let's see if we can draft a business opening plan and kind of put some dates and put some kind of approaches in place that we started hearing discussions around the world about, and put it together as a draft, kind of throw some spaghetti at the wall and publish it and see if we can get some discussion going, not in any critical way in terms of government, but more of a collaborative approach to kind of throw something out there to generate some discussion so that government could see what people were cool about in terms of going so far on certain things and what they weren't. And it wasn't long after that, the government came out with their own plan. I'm not saying we took credit for it, but it was more, again, it's that collaborative approach that they came out with it. They were very conservative in how they rolled it out, taking their time with each phase that they rolled out. So we have 4 phases in New Brunswick. So we have yellow, orange, red, and lockdown, black. And there's very clear rules that everyone knows, and they're published, that if something happens in yellow and it's a certain number of things happen in terms of whether it's community transmission or a certain number of cases or a concentration of cases, that it will trip it and it will automatically kick into orange. And we all know that. And the same thing happens when other things keep going, it'll kick into red. And sometimes we'll go from yellow right straight to red if it goes really fast. And sometimes we'll have to move to lockdown. And so those are all published. But one of the other things that we also have, and again, we're a province of 720,000 or so, we have 7 health zones in the province. And each one of those zones can have a different phase color. So right now in the province of the 7, 1 is in orange and the rest are in yellow. So yellow being 1 step away from green, which is wide open, back to normal. And so even though we are most of us are in yellow, and it's not a requirement to wear masks outdoors. You'll see a lot of times at least 50%, if not more, of people walking around the streets wearing masks. In our province, it's 100%. If you're indoors, you're wearing a mask, unless you're in a restaurant with, you know, certain things around. And it's based. I have not seen a single person in the last, since we implemented it, that has not worn a mask inside. It's basically, I've seen 100% compliance by everybody. In fact, I think it was kind of a breath of fresh air, and we could all take a sigh of relief up until the point that we said it's 100% everything indoors. You saw people, you know, it created a bit of animosity. People were wearing masks and others were saying, I can't wear a mask, or can't do this and can't do that. And they had all different types of excuses. Once it became law, 2 days later, 100% compliance. So I think from our perspective, maybe I'll end on one point that you wanted me to touch on, Andy, is, you know, whether you're a business owner or you're a citizen, you know, as a business owner, you are a citizen. You live in a neighborhood. You know your neighbors. So as a business, you know, we also want to comply. We all have our own COVID-19 operations plans. We had to all write them. We have to have them stored and ready to go anytime we were asked. And I think the other thing too is that we have a tourism business, my wife and I, and, you know, with the borders closed or managed, to use Kelly's use of words, well managed, very tightly managed. Even with the bubble, it was last year, it was severely restricted a lot of tourism businesses. But again, being a citizen, community first, we just found a way to make it work. That was, every business tries to find a way to make it work. Everyone, they're buying local, trying to do different things to help businesses survive. And honestly, thank goodness so far, we haven't seen very many businesses close, and they've found a way to make it work. One thing I'll leave with you too, because it's probably something, it's a bit different than Nova Scotia. We haven't used a lot of rapid testing, but we have used very precision testing and very tight border control, or border management. So for example, when we had an outbreak in the Edmundston zone, or zone 4 up north, that whole zone went to lockdown, went to red, and then immediately went to lockdown. But then as they started determining whether, like where it was actually happening in the Edmundston city area, that they literally created a new kind of border, if you want, around lockdown, around a specific city. And we don't have border patrols at the zone lines, but it's well known that when a zone is a different color than yours, so if the next zone over is orange, or if your zone is orange and the next one over is yellow, you're not allowed to travel outside of that line. And we commit to that. We don't do it. And one of the other things too is that for travel, New Brunswick's biggest thing has been border management. So there are people that can come into the province, but it's highly restrictive. So it's generally only essential workers, truck drivers, and that's pretty much it. No, even if you own property, summer property, you can't get in right now. If you do come in and you are a New Brunswick citizen, you have to, currently you have to go into a hotel and you have to do 7 days of isolation in a hotel. There's no home isolation anymore. It's in hotels because they want to further manage it. And you have to have a test after day 5. And if you're negative, then you go home and you do a further 7 days at home. If you're home, you're the only one in the home. And if you're not, you stay in the hotel and you pay for it. So we literally have those levels of restrictions that are far beyond, I think, any other province right now. But what we have known is when it comes to cases, the only way we get cases is through our borders. So I think it's something like 80+%, and it's always been this way, of New Brunswickers saying they want the borders tightly managed because they know that's generally where the cases are coming from. And if we can keep it low and we can be super focused in terms of testing and restriction around a certain zone until it's tamped down and we use a fire hose on a spark, then we can continue to move back to yellow and we can continue to have a lot of freedoms from that perspective. Yeah.
So very different approaches, I think, compared to what we're used to here in BC and west of Quebec. A number of themes coming up: the importance of border management and travel, the importance, I think, of political will and being very clear about what the objectives are. But I want to open it up now to everyone as an opportunity for you to ask questions of each other. And I think as we go, I will sprinkle in questions from those that are tuning in as it makes sense. But I want to open the floor to everyone so you can have a conversation with each other.
I would like to ask a question of Lisa and David. I guess one of the things we're often told is that we're not like you guys. You know, you have like 2 roads going in and we're just so much bigger and exceptional. What would you say to that? Like, I know the population is bigger in BC, but are we so exceptional? I mean, I don't know. You managed to do it. We haven't. And they said, because we can't do that. We're not like you guys. So I just wondering if you had a response to that.
David, do you want to go first? Or?
No, go ahead, Lisa. I just spoke. Go ahead.
Okay. Boy, if I had a dime for every time that somebody says that about anything good that happens in a small province. But anyway, but you're right, that is the first thing people say. And when you know, I'm an infectious disease doctor, and I'm also a quantitative scientist who works in a lab on immune cells. So I like things that are a little bit black and white sometimes. I also love people, and I recognize that pandemic management is about people and behavior as much as it is about modeling numbers and what we do. And so when I start to say something like part of our success has been people engagement, community mobilization, that's the point where people start to really get angsty and say, you know, oh yeah, your geography, that's helped, you know, water on several sides, also helpful, similar to BC, one would say, another coastal province. But it's the part where people start to say, we're just far more complex as a population of people in pick your province and insert name here. And I kind of try and remind people a little bit that it is a little bit of the economy of scale. Every single place is a group of communities of people. You just need to find the unit of community that's engageable to make things happen. And then at a government level, I think it is important to have clear direction. But it doesn't matter if you give people clear direction if the engagement part's not there. Although David, you think that, you know, Atlantic Canadians are quite, you know, sort of adherent intrinsically. I think they are to a certain extent, but they're far more engaged and on board when they're actively engaged, as opposed to just being told what to do. And so when people say that to me about, we're just, you know, we can't do that here, we're too big. We have international flights that come in all the time. We have borders with the United States and some of the most high case parts of the United States, with people zipping back and forth. The answer is not that. And I really and truly do believe that part of the right answer is the person engagement. And I think that's where we've fallen down. And I also think it's absolutely possible, no matter how big you are, you just got to find your right community unit to act upon.
Yeah, I that's a really good way of putting it, Lisa. And maybe I'll actually build on what Nick's story, basically. You know, Nick's story really resonated not only in Nelson, but also in other parts of BC that were similar. Like that's Nick, those words you used, Nick. And, you know, just to build on what Lisa's saying, you know, Nelson is a very tight-knit community from what I know and from the people I've met there. So, and, you know, starting with those, and like, when you think about, like I said earlier, like we have 7 health zones with these like imaginary, well, I shouldn't say imaginary, but imaginary borders. There's no people standing on those borders with police cars or anything. It's like, we just know that this is our zone. We know where the borders are, and when we're engaged, and we're kind of like, it's almost like we're a team. It's like Team New Brunswick when we look at the results every day, and we take it personally. Like when I see that there's 10 cases, I'm like, oh, like where are those cases? And when you look at are updates that's, let's say, CBC and Global and all these others publish. But if you look at them, they completely are like a mile long, and they talk about every specific case, where it is, by which zone, what the age was, whether they were connected to travel or not. And when we see not travel, then we get worried and we start wondering, wait a minute, which ones is that community? And we want to know, like, we're literally that engaged. I know my wife, every time that there is our chief health officer, chief medical officer comes on and does her update, which has happened probably, I'd say maybe 200, 220 times. And amazing that she's so focused on that and has had really no life for the last year and a bit. I asked her the other day, how many of you missed? She said maybe 2. Like, she wants to listen. She wants to understand what's happening. What are the new rule changes? And there's tons of people on that thread, all talking, all giving thoughts, all kind of thing. No one's crapping on stuff. They're literally trying to figure out what are the better ways of solving this potentially, and what can I do as to be part of it. So I think Lisa's bang on. I think you find those communities, maybe you draw lines, maybe the zones in BC, if we had 7 with 700,000 people, maybe you guys should have, I don't know, 30, right? And Nelson would be one as an example. And then Nelson can rally inside of its zone and say, how can we get it down to yellow? How do we keep it at yellow? What can we do? And then overall, it's Team BC, and all these teams are all working together in their zones. So
building on that, we have a question that came in, and I want to jump to some of our audience questions. Do border closures really make sense when you still have community travel so widely within a large country like Canada? Wouldn't a more localized approach targeting specific hotspots make more sense? And then I'm going to throw another one in. I think a few people might want to respond to that. And this is a shorter one. I'm curious why Canada quickly restricted flights from India and not Brazil.
Those are great questions. I think we have to look at travel, local, interprovincial, national, international, all is, causing a risk. So any travel. So during this pandemic, when there's been a need to reduce transmission, it's kind of like, thinking we've got to stay still, whatever scale we are at. And so that means we start with our outer defensive walls, and we stop people from coming in to the country that are potentially carrying variants, or at least we detect it and we keep them safely quarantined. And then we move down to the provincial and the local level. And the less that we travel around when we're having circulating virus, that is good. Obviously, if we reach the point where they have in the Atlantic provinces and the cases go near zero or even zero, other countries, Australia, New Zealand, Taiwan, South Korea, et cetera, then you can open up inside. But until you secure those perimeters and get the virus within the perimeter down to a minimum, we have to look at all travel. And that doesn't mean, what we're seeing at the international border replicated at the provincial level. We don't have checkpoints and so on. We can create other ways of doing that, disincentives. We can create some, community monitoring, as we've just heard. It works very well, but we have to think about travel as a whole. So why didn't we target Brazil? I think that goes back to my first point in my previous discussion, was that we can't look at just hotspots. We have to look at all travelers coming in, because travelers mix outside of the country. They pass through airports, they go to the third country, second country. As they come through, they may not have a direct flight. Variants are moving around. We know the B16, 17 is already in many different countries now. We can't just say it's coming from India and Pakistan. So the idea is to put up your perimeter. All travelers that are coming in may have the variant. We're just going to assume they have it and treat them accordingly. And that's a much better way. Otherwise, how did it get here in the first place if we're so good at targeting? We're always we're always reacting with targeting hotspots. We're not proactive.
Can I move to the future? I think we've done a lot of kind of looking at what's happening now and what's happened in the past. And I do think it was very, very unfortunate that with the variants that we have now, we had the best data we are ever going to get about transmission and the rate of transmission of especially the B117 variant that originated in the UK. And that was kind of great genomic surveillance from the UK. They do a lot of sequencing, and it was kind of blind luck that we ended up knowing when we did that that variant would be what it is. To me, I think one of the questions that keeps me up at night is the virus has been experiencing selection in favor of increased transmission, because in its first year, it was facing a world where it was brand new in that world and all the people were susceptible. There was hardly any immunization. There were some people, of course, tragically, who got infected, but most of the world's population is still susceptible. Now, though, we're immunizing, and we're immunizing large populations in the UK, in Israel, in the US, increasingly in Canada, in Chile, in many countries. And the virus will be seeing selection in favor of vaccine escape for the first time. And it's likely that those vaccine escape infections maybe won't make vaccinated individuals very sick. Let's hope that that's true. It might not be true. That's a big gamble to say, hey, brand new virus, it's going to be experiencing selection. Where's it going to go? Maybe it won't make us sick if we've had these current vaccines. Let's hope that that's true. Fingers crossed. But I think one of the things that distinguishes the mitigation versus stronger, more active mitigation, zero or elimination approaches has been the kind of precautionary approach. Do we hope that that doesn't happen? Do we hope that because we don't know really that B117 will really be like that in our local population, that it will really cause pressure on our hospitals? So we don't know that it will yet. So let's kind of not try a variant zero approach when we see that coming. I think it was in hindsight, we should have done that. Hindsight is 2020, but now we can also use that hindsight to think about foresight and what are we doing as a national plan, thinking forward about not only does this virus evolve, yes, it does, it will keep evolving if evolution is not going to stop, but will it evolve to something that threatens our vaccines as a way out of this, that can get into vaccinated people and make them sick and threaten or challenge people around them who have declined the vaccine or who are too young to be in our current rollout. So I guess what I'd like to hear from the business community, from Kelly of Borders and from Amy and Lisa, what are we thinking about a Canadian approach to the next stage of evolution of this virus? Do we want to coordinate across Canada? Do we want to, like, maybe the immunology is so strong in favor of this will not make us sick if it does escape the vaccine, and we should just get vaccination is going to solve this and we're done and we don't need to think about COVID zero or these border measures anymore? Or do you think we really need to be ramping up the borders while even we suppress transmission with vaccination? So I'm curious what you all think about the post-vaccine world, the businesses in the post-vaccine world, introductions, borders, medicine in the post-vaccine world.
Carolyn, before before others jump in, can you speak very briefly just around the issue of vaccine escape and how that factors into this? Because we haven't really touched on that a whole lot, and I think that might, I'm guessing, influence what other people have to say. Like, how seriously does that need to be taken?
Yeah, so, in a way, it's another thing we don't know, and I don't want to wait until we know we have a scary bad thing, because we need hundreds and hundreds of cases to estimate a fatality rate, and then by then we have hundreds and hundreds of cases, and what do we do? But the idea of vaccine escape is this: we know that vaccines they're wonderful, they're incredibly effective. I'm delighted to have one. Go get one. They're great. But we know that their efficacy is not 100%. And so we know there have been people who've been vaccinated who've been infected anyway. And mostly those cases are mild and they're much, much better than getting COVID. So go get your vaccine. They're great. But they're called breakthrough infections when someone is vaccinated and infected anyway. And they may be able to infect others, probably at a lower rate with a lower viral load. So, it's all good. But that's the selection that the virus is going to be seeing. So as we get everyone vaccinated, a virus that can do that will have an advantage over its little brother who can't do that. So the virus may, and then if those people are infectious, even at a low rate, because COVID's pretty infectious, so you can be quite a bit lower than the current COVID, and still, if we reopen, imagine that virus is in a vaccinated individual who isn't sick, and we aren't testing, because we're not testing 1% of our population with rapid tests every week or two, so we don't notice. And that person with that virus goes to work and goes to a party and goes to the store and has a household gathering and then goes to, we do normal reopen life. They may infect people who haven't been vaccinated, and that if there are enough of them around, that's a huge problem, even if the vaccinated person isn't sick. So that's like the optimistic part. The more pessimistic part is, what if that virus gets that vaccine escape in a way that allows it to achieve large virus populations inside vaccinated individuals, and it does make them sick? Are we back to where we are today? We need to wait for Moderna and Pfizer to update their vaccines. They will do that. That will be great. But then we'll need to redeploy the vaccine, the minus 80 freezers, and the logistics of the vaccination rollout and the whole thing. So I guess what keeps me up at night is, do we know in time? How do we know in time? Do we act? How do we act? And, are we just fingers crossed it won't make vaccinated people sick when it happens? Is that the stance? And I'm genuinely uncertain in my own head where we land for COVID-0, what these risks are. So I'm curious what the panel.
I want to go to Amy, who we haven't heard from in a bit.
So I'm going to actually defer to Dr. Barrett about, boosters and vaccines as the infectious disease person on the panel. But I can say from a clinical perspective, as somebody who works in hospitals right now and is poring over this, is I really think we need to actually be in BC specifically in response to what I'm hearing government is planning or not planning to do, is really actually be keeping an eye on the variants and actually be doing the genome sequencing. And yes, it's fine to say treat everyone as though it's a variant, but we actually need to be keeping an eye on it. And specifically with the breakthrough variants, we're hearing the last week that people who have had one dose well over 14 days, so in the 60 to 80% efficacy of vaccine with one dose, they're getting really sick now. And so I would want to know, which variant is involved with this? What is the severity of the illness? Does it lead to death? And then also, what is the attack rate in households? Because we know that with variants, there's a higher attack rate within households. And so I actually think, in order, like you said, to be precautionary, we need to be looking at all this so that we see, as Dr. Barrett said, those niggly little signals, so we can actually act on it. Because like you said, hindsight is 2020. We let this third wave happen. Let's not let a fourth wave happen as we continue to vaccinate. But I also think that as we reopen, we need to, I think, really ensure that we are still taking care of the people that have been continually disproportionately affected by COVID-19. And until we make essential workplaces more safe, schools more safe, this continued transmissibility is still a risk. If you look at Brampton, they closed schools for 4 weeks. They have a lockdown. Their test positivity is still over 20%. Why? Because the essential businesses are still open and they're still crowded and they're not being protected and there's no paid sick leave. And so it just continues to spread like wildfire. So we need to be looking at, yes, I know we all want to, be able to go shopping and go to parties, et cetera, but there's also the fundamental kind of what keeps society going. And that's actually how I got into advocacy, was when this all started in March and April, and I was in Northeast Calgary, and my patient population in family medicine were all essential workers in Northeast Calgary, recent refugees, new immigrants, and they all didn't feel safe at work. And they all had to work during the first wave when it was incredibly uncertain and incredibly scary because of what we were seeing in Wuhan and Italy and New York. and they were not feeling protected by their employers and by society, quite frankly. And so I really feel strongly that we need to not lose sight of that as we reopen, we need to be keeping the fundamentals of society as safe as possible, because we are learning through COVID-19 that we're not safe until we're all safe. And if we don't clamp down on essential businesses and workplaces and keep them safe and the workers safe, it's just unfortunately a breeding ground for more cases and potentially vaccine escape.
So with that, I want to go to Dr. Lisa Barrett. Is the Atlantic province's strategy, are those the foundational elements you think in getting us through the next phase here of ramping up vaccination and really being in a place where we can anticipate that there will be variants and new variants of concern and there will be vaccine escape?
So I'm an immunologist in my spare time. I find it a little startling that we don't talk a little bit more about this. I understand the fear and need to make sure that vaccines are very much the tool that we have, our gleaming new tool, as Carolyn says, and I love that. But the only time a virus doesn't mutate, particularly an RNA virus, even if it's one of the coronaviruses, the only time it doesn't mutate is if there is no replication. And that means no cases. And so eventually, viruses being smart, they've already developed their own little immune escape mutations, and that will continue if we continue to have cases. And you mentioned earlier the global part of this. We don't want to just be Canada locking everything down and never ever looking up either. But if we don't, and to think of getting out of this, if we don't have a good combination, and I'm not actually certain that the Atlantic provinces, all of them, have bought into this yet. If you don't combine high vaccine immunization, and PS, you're going to need the engagement that you see with some other things to get people vaccinated at high levels, with testing and surveillance as we go forward. If you take any of those items away early and you don't measure what's going on at your borders, I don't think we can keep our borders closed forever, hopefully for a while longer until this immunization part comes forward. But managing the borders better in combination with testing and vaccines, if we leave out any of those three things, the virus will replicate, it will mutate, your immune system will create pressure, and it'll be a vicious cycle like we have, for example, with flu every year, flu is great, except flu is much milder than this. So we can't sustain, COVID-21 is the way I think of these variants now. It's not COVID-19. This is a new problem almost. So I don't know actually even that Atlantic Canada as a whole has really synthesized that yet, but I think the bits and pieces are floating around in the air, and I'm hoping the puzzle comes together quickly. But if you take away any of those three, humble opinion, from the vaccine testing and the border part, I don't think we're getting out of this well anytime soon.
So with that in mind, I want to go to Nick. I mean, we're going to see a lot of vaccine supply coming into BC and just like all other provinces. I mean, from what you're hearing, is it worth to make, I mean, I think when we think about elimination versus mitigation, really getting to a place where we have very low transmission, then cautiously be in a place where business activities and social activities can open up within clear parameters, and there's some clarity around what we are doing and the thresholds involved. I mean, how does some of this conversation resonate with you in terms of what you need as a business owner for certainty in your operations?
Yeah, it's tough because the restaurant industry is such a head down industry. You can really look within your own walls. But I do feel that we've been very reactionary in BC as opposed to getting ahead of this. And Carolyn touched on earlier that we didn't have the data starting out. We didn't really know what other places were doing. David was saying that other provinces didn't have a template or an idea that might work. And for me personally, I think that now we do have an experience. We've been at this for a year and a half, and I just think that we're still reacting. And I think COVID fatigue's real. And I think from a day-to-day business operations, it's really hard to keep my staff focused on the little things that we're asked to do if it doesn't really seem like it's working. And we're so far down this little rabbit hole. It's shocking to me we don't have rapid testing. We don't have the COVID app working provincially that was developed nationally. And I just think that the guidelines are great. They've given us a lot of chance, but I think in Nelson specifically, we've been really fortunate that, as David said in the Maritimes, the community is really looking after the community. And I think we would have never made it through the summer with how much business everybody was doing. It was an epic year for everybody in town. And we've scratched our heads a lot, but I think that the sense of community is what kept us safe then. And I think it's going to be a really, really good buffer going forward. But I think from all levels of down to the municipal government, we just need a little better guidance. And maybe I'll take some things that David said and kind of rally the business community continuing forward and try to push our own objectives and our own decisions. But I think that there's a lot of data that we could pull from now. I mean, I probably watch the news more than I should, and it's tough sometimes. You know, asymptomatic testing in France was a big thing a year ago, and they started doing cross-sectional, random testing. And I think that all these things will help the business community be more confident in our decisions, and I think it'll allow us to have more certainty that reopening will be the right decision. I love to do more business, and I think it'd be really, really nice to be busy again, but I definitely stay up at night worried about this. And I haven't really told many people, but my mom and dad are actually in New Zealand and have been for 15 months, and they're kind of not coming home till this is sorted. And every time we fall further into new cases and that, they kind of recoil and stay put. So I have an existential vested interest in kind of hoping this gets sorted sooner than later. So.
Thanks for that, Nick. Just mindful of the time, I want to try to do a closing round, and we haven't certainly gotten to everyone's questions, but I think a number of them have been answered in different ways. And there are a number that came up around, what should we be doing going forward, just very directly and practically. And this is within the context, obviously, of a very critical time with our vaccination campaigns ramping up. But I want to go around and ask you in under a minute, give us 2 to 3 things that you think we absolutely need to be doing in BC to chart that strategic path out of COVID-19. Mindful that there's still lots of uncertainty and the science is evolving every day. But what are 2 or 3 things that will equip us to be back to some degree of the lives that we had pre-March 2020? So I want to start with Dr. Kelly Lee.
Okay, so we need to fix the holes that I've described earlier, both at the federal and provincial levels, and that will give us a firm foundation upon which we can continue to vaccinate, moving to children to achieve, vaccination of children and hopefully achieving herd immunity. We also need to do this to prevent a 4th wave, of course, and that could potentially be caused by a variant. So beyond this, we then create a foundation for gradually then easing some of the measures that we have put into place, start easing them locally and then interprovincially, and we'll see how we go. I think it's going to be very gradual. And then we turn to the international border management issue. And, if people are vaccinated and coming in, we treat them a certain way, still testing and so on. So we're trying to work all this out and how we can ease those measures, just to give people hope that we're not going to be like this forever. Use testing, use quarantine for those who are not vaccinated, and genome sequence like crazy still, because we still have to keep on top of the variants. They're still going to be coming and arriving on our shores. So we have to make sure we identify them and keep them from going into the community. Sorry,
Thank you. No, that's all right. Over to you, Dr. Carolyn Colleen.
Yeah, so I love what Kelly said, so I'm going to add mine on top of that. So we should do everything Kelly just said. And we should think about vaccine escape, think about evolution of the virus, and get a plan in place just in case that does happen. Get a precautionary plan, hopefully coordinated at the Canadian level, but even within BC. And I think that plan involves a lot more use of rapid tests. I know there's controversy around, skepticism, I guess, not so much controversy, but around the whether it's as high a quality test as PCR test. I don't think that's the relevant comparison. I think the relevant comparison is no test, which, rapid test could be added where there is currently no test at all. So rapid testing for that monitoring and establishing that virus surveillance, which I think we are doing, and it's fairly strong in BC, but it would be stronger pooled across the country. So I think that's right. We should move to a strategic plan for reopening, close those holes. We now have our shiny new tool. We should use it. So getting vaccines out to the population and then making sure we get those second doses when people have all had their first dose. Within that 12 weeks, that's going to be really important for keeping that immunity high and preventing spread of anything that does escape vaccine.
Great, thanks. And I want to go to Dr. Barrett now.
Okay, so I'll galvanize the first layers of those armor bits that you've just mentioned, because I'll agree with both, and say there's two things, and it's kind of similar, but a little different. Number one, I do think you need to give people something to hang on to that they do themselves, not just stay at home. The challenge with the stay at home problem, it's not a do, right? It feels very inactive. It feels very passive from a human behavior perspective. Give them something to do. And heck, if that's a rapid test they can do at home, wow, how convenient and important would that be? And I think that's a really important part. And then number two, I think it's egregious that we have one province that reaches a reproductive number of 1 and everything shuts down and nobody dies or very few people die, and another province has to reach 6 or 2 or 4 or wherever you get to, and lots of people die. It's only one of the numbers, but you reach 5 indicators, you don't shut down. I think you need a national plan. And the reason I think that's important for one particular province is that virus replicating somewhere else, immune escape. You need a Canadian plan, and there has to be federal leadership around fixing this. So, hey, active testing engagement as a tool of engagement. I don't care if it diagnoses anything, to be frank, and I don't care what the sensitivity is, almost. It's a tool of engagement, and number 2, a federal plan.
Great, thank you. And I want to go to Dr. Tan.
Okay, I have a whole list, but I'm not going to go through it all, just so you know, though. But so I agree with the last 3, and I would like to add on top of this, asymptomatic testing. Asymptomatic testing in schools, as Dr. Barrett said, there have been non-epi-linked cases in schools. We need to be looking. We can't just merely say it's not happening in schools because we're not testing for it. We must do that. We need clear goals and thresholds, probably part of a national approach at this point, but we need clear goals and thresholds that, like David has been saying, that people can actually galvanize around and go, hey, where are we at? What's going to happen? And actually have goalposts that actually don't move around so that we can actually know what's going to happen. And then, as I just said quite passionately, is make essential workplaces more safe, paid sick leave, all that, because we're not going to get out of this without taking care of everybody. Thank you.
Great, thanks. And with the business perspectives, keeping it in less than 1 minute, I'm going to go to you, David, and then round us out, Nick.
So I'll build on what Dr. Tan just said. I agree. The rules here and knowing what triggers what type of phase has been key, but I'm going to build on what Dr. Barrett had said, and that is engaging community. And the only way I think you can do that is get granular. So break BC up, on a map and find your natural communities, like in the case of where Nick lives. If there's a Nelson community, make it granular. Draw a border around that in terms of that's being a zone. Allow the zone, if you know the rules of the zone, then that zone will aim for trying to get down to 0 if it can. And the thing is, if it's granular, and every day you report granular, all the cases by zone, so that you know where you are, you know the score, you know what you're aiming for. And what happens is, then if you do that, all the nicks of every one of those zones we'll all engage and get people all rallying behind something. How can we work together as a team? And I think when you do that collectively, you'll conquer it by doing that. When you do, you get granular like that.
Thanks, David. And over to you, Nick.
Yeah, so I think just sticking in line with that message, I think that what I know is community and local business, and I think that on a provincial scale, support the businesses where you live, and if you do travel out of zone, be very cautious and wary of contributing to the problem. You guys, the doctors in the field and the nurses in the hospitals and that have a way more stressful burden placed on them from COVID, and I just think the original message I put to the public was just, if you're going to move about really cautiously, and I think there's a way out of it if we kind of shrink the world down to a little smaller place and support local and do business with your neighbors and try to strengthen that sense of community. I think Nelson's an amazing place, and we're not alone. There's a lot of cool places like this where meeting your neighbors and doing more business with them would be a very beneficial thing, not just during COVID, but for the years to come. So thank you very much.
Great. Well, I want to thank you all so much for taking the time to offer your insight and really contribute to what I thought was a really interesting and powerful conversation about what we need to be thinking of as we go forward. So I want to thank everyone for joining us for this discussion. And obviously, we always hope that there's more time, but please do stay plugged in and I think these conversations are really important to be having in our communities. So again, thank you to the SFU Faculty of Science and Faculty of Environment for sponsoring this public event. And again, thank you to our speakers and all of you for tuning in, and have a wonderful evening.
Thank you, Andy. Thank you, everyone.
Thanks.
Thank you.